Our next presentation by Dr. Piyush Kohli, Incidence of Ocular and Systemic Disease affecting visual function among state bus drivers.
Good morning, everyone. I'll be presenting prevalence of ocular and systemic diseases affecting the visual function among the state drivers. It is prevalence. How to move it? Okay, so let us understand the magnitude of the problem. So road traffic injuries form one of the leading causes of death. In 2017, it was ranked 11. In fact, by 2030, it is estimated to become the 5th leading cause of death. The greatest burden is in low and middle income countries. So what is the magnitude of problem in India? Although a large number of road traffic accidents go unreported, it is reported that 1230 accidents, 414 deaths, and 1237 injuries occur per day, out of which 84% are among the working age groups. According to World Bank, 10% of Indian hospital capacity is always filled with crash victims. The social economic loss that leads to is 3 to 5% of the GDP every year. So what is the role of buses in Indian transport? Nearly 1.7 lakh buses and 5 crore people ply daily on Indian roads. 85% passengers and 65% freight travel by road. So in 2019, buses led to 4.9% of the road traffic accident related deaths. So what is the problem with Indian roads? Roads lack segregation for motorized and non-motorized traffic. And the heavyweight vehicle drivers need to be overcautious to prevent the road traffic accidents. So what is the need for this study? There are several lacunas in the laws related to driving licensing in India. First is the visual requirement is based only on the visual acuity, whereas the other functions are ignored. The ocular and systemic disorders, which can hamper the driving proficiency, are also ignored. So evaluation of incidence of these diseases among the current driving license holders will help us establish the baseline epidemiological data for the high-risk drivers, as well as establish better road safety laws. So aim of the study was to evaluate prevalence of the ocular and systemic diseases affecting the visual function among state transport corporation drivers in South Indian district. So this was a retrospective observational cross-sectional hospital-based study performed at Arvind Eye Hospital, Madurai. The records of all the drivers who came for mandatory annual checkup in 2019 were evaluated. So the rules of the State Transport Corporation were that mandatory annual ocular examination was needed, and fitness for criteria was BCVA should be at least 20 by 20 in the better eye and at least 20 by 40 in the worse eye. And there should be no defects in the color vision, in the visual axis, in the night vision, in the visual field, and the binocular single vision. So all the tests that are usually performed. And in case of any pathology, appropriate systemic and ocular investigations were done and the patients were treated. So we evaluated a total of 3042 drivers with a mean age of 47 plus minus 5.7 years with a range of 29 to 61 years. So visual function threatening systemic disorders were seen in 761 drivers, that is 25% of drivers. And in fact, 2 were diagnosed to have hypertension based only on the ocular examination. So among these 761 drivers, 63% had diabetes, 30 had hypertension, 5 had ischemic heart disease, 2% had others, which included tuberculosis, HIV, chronic kidney disease, neurological disorders, and blood dyscrasias. So refractive errors were found in at least 45% of the patients, 460 were myopic, and 917 were hypermetropic. A spherical equivalent of more than 1 diopter was seen in 8.8% of the drivers. Visual function threatening ocular disease was seen in 9.5% of the drivers, out of which only 1.5% complained of visual loss. Other had just come for the regular examination. So these diseases include DR in 42% of the patients, which included PDR, non-proliferative diabetic retinopathy, the central involving DME, macular ischemia. In fact, the incidence of diabetic retinopathy among drivers with diabetes mellitus was 21.3%. The other disorders were cataract, glaucoma, out of which majority had primary open angle closure glaucoma, but a majority had primary angle closure also, CSCR, and others. Others were RVOs, pterygium, retinal hole, toxic optic neuropathy, etc. So visual significant cataract was seen in 1.9% of the drivers, out of which 15 had bilateral and 2 had traumatic. 2.2% underwent surgical intervention, out of which 41 had cataract surgeries. 13 drivers were undeemed for fitness. So UN has announced 2011 to 20 as decade of action on road safety. Reducing the number of road traffic accidents is related deaths is among the UN Sustainable Developmental Disorders. The government of India is committed to reduce the road traffic accidents and death by 50%. So So why is diabetes a risk factor? It's not only because of the visual function, but also because sudden hypoglycemic episodes while driving can lead to cognitive impairment and psychological retardation. Also, peripheral neuropathy can impair the sensation and proprioception in the lower limb, which can affect their ability to gauge pressure on acceleration, brake and clutch pedals. Then diabetes in our study, incidence was 20%. It is estimated that the incidence of these metabolic disorders in bus company employees is higher compared to the general population. That is because of the long working hours and the sedentary lifestyle. The incidence of diabetic retinopathy among the diabetic drivers was 20%, which is much higher than the Indian population, which is about 9.2%. Then 40% of the people suffering from glaucoma can experience driving difficulties. Incidence of glaucoma in our study was similar to the general population, but these drivers have to drive in the evening and they are at high risk of angle closure attack. So shallow angles may benefit from prophylactic laser. Without spectacles, nearly 50% drivers fail to qualify the visual acuity criteria, so the compliance to spectacles at work should be checked frequently. A number of patients had cataract, which can lead to glare during the evening drive, even though they have a good visual acuity, which can delay the response time delayed due to the headlight glare, which can increase the risk of collision. And CSCR also leads to metamorphopsia, which can impair the ability to judge distances. So an early laser can be done in these patients. To conclude, several bus drivers suffer from vision-threatening systemic and ocular diseases. Some may even require surgical intervention. We should evaluate the ocular and systemic diseases with vision-threatening potential at the time of license renewal. The driver should be educated about the systemic and ocular disorders that can affect driving skills, and they should be encouraged to seek the medical help at an early age. Importance of treatment compliance should be emphasized to these patients. Thank you.
What about the color vision testing? Did you do?
Yes, no, color vision testing was done.
Thank you, doctor.
Sir, can I ask one
Yes,
question?
sir.
It's a retrospective study on a hospital-based data.
Hospital-based data.
Still, you are giving information about incidence. You are giving information
Prevalence.
prevalence. In retrospective data, incidence can be assessed only. How you assess the patient coming to hospital?
Yes, sir.
Then how do you know about incidence?
So this was prevalence, not incidence. I'm sorry.
It is not even prevalence. Prevalence is definitely by cross-sectional study.
Yes, sir.
It is just a proportion of patient coming to hospital. It is not incidence or prevalence at all.
Okay.
And everywhere you have mentioned these two things in
Yes.
this is totally actually not acceptable.
Okay.
It is just proportion of patient having these disease.
Yes, sir.
And having prevalence of diabetes so high among truck drivers, and it automatically shows it is not incidence of prevalence.
Okay.
It has to be proportion only.
Okay.
Right?
Yes. Thank you.